Okay, guys, so let's talk about blood vessels. So there are three types of blood vessels. There's arteries, capillaries, and veins. Okay, arteries are the big, very elastic vessels that you can feel a pulse in. And the reason they have to be very elastic is because sometimes your heartbeat is beating really hard and sometimes it's not. And so the arteries have to be elastic so that if all of a sudden it needs to really pump out some blood, they can stretch. Capillaries are the smallest vessels, and those are what bring oxygen to the very smallest cells in your body. And then veins, we already know veins are what bring deoxygenated blood back to the heart. So arteries, they are systemic circulation. We've already talked about this. They carry oxygenated blood away from the heart to the capillaries. And the pulmonary circulation is the only artery in the body that carries deoxygenated blood away from the heart to the lungs. So let's get the layers. So the layers of the heart. So the very, very outside of the heart is called the tunica adventitia or externa. And it's a very tough, fibrous connective tissue with lots of smooth muscle cells. And this is what gives that artery that elasticity that it needs so much. It allows the arteries to increase in size when the internal pressure gets higher. Sorry. And so that's the outer one. The middle one is consists of muscle cells arranged in a circular pattern. So you have the outside with smooth muscle, the inside in the tunica media, that's the middle layer. They're arranged in a circular pattern, and that's so they can dilate or constrict. And the tunica intima consists of three small layers of endothelium, which is a smooth lining so that there's smooth flow. You don't want to have a rough surface because if you have a rough surface, platelets can get stuck, cholesterol can get stuck, and then now you have a problem. As the aorta leads away from the heart, it branches into smaller arteries. So they get smaller and smaller as they go through the body. And then the smaller arteries, you have small arteries that branch into arterioles. And those are even smaller than the small arteries. And then the arterioles branch into the capillaries. Now, the capillaries are so small that they can get blood to the smallest cells in the body. They can only be seen under a microscope, and they're connected to venules. Venules is the smallest portion of a vein. The branches of the finest arterioles are known as meta-arterioles, and they lose most of their connective tissue and muscle, and they're basically just simple endothelial cells. And you need that for efficient diffusion in the body. When you're dealing with circulation. So it goes arteries, small arteries, arterioles, meta-arterioles, and those are in the capillaries. Okay, those make up the capillaries. So the capillaries, like I said before, are the smallest blood vessels. And they connect the arterioles to the venules. They are a simple endothelial cell layer. They have selective permeability, which means they don't allow just anything to go back and forth. They allow nutrients and oxygen to pass through, and they take carbon dioxide and nitrogenous waste back into the blood for excretion. The tiny opening does allow for white blood cells to leave a bloodstream and enter the tissue. So if you have an infection, they do allow for white blood cells to go into the tissue so they can attack the bacteria. Sometimes plasma follows, so that's the interstitial fluid inside the veins. That's what makes up the fluid. And returns, and they return in the form of lymph through lymphatic vessels. So the white blood cells go in, they fight infection, plasma can follow, they beat the infection, but instead of going back into the bloodstream, they go back into the lymphatic system, and that's what takes them away. So blood flow is through capillaries is influenced by hydrostatic pressure. that has to do with, water. Okay. So the force exerted by a fluid pressing against the wall of the vessels. So hydrostatic pressure equals capillary blood pressure. And what happens is that hydrostatic pressure, it's pushing that fluid against the wall of the vessel. And that's how it pushes fluid out, um, but it leaves behind cells. It pushes fluid through the wall, but leaves behind cells and proteins. It is the system is ultimately what um, gets blood to all the tissues, but not all capillaries open simultaneously. Um, So the system allows for blood to flow to active tissue. For example, exercise. Muscles need more oxygen, so blood flow increases and decreases in areas that don't need it, like your diaphragm. I'm sorry, your digestive system. So when you're exercising heavily, it's diverting blood from the digestive system to where you need it in the muscle. So it's not only it's the system works in a way that it's not only just blood goes everywhere and everything goes in and out. There's reasons the body sends it to places. Veins carry deoxygenated blood away from the capillaries to the heart in systemic circulation. That's systemic circulation. Okay. It has the same layers. Okay. But the walls are much thinner. So it says the same as the arteries, same layers, but they're much, much thinner. They don't withstand as much pressure, so they collapse easy if not filled with blood. This is what makes it hard to do an IV in the ER if somebody's very dehydrated. That if the veins, if they're dehydrated, there's not enough fluid in the vein, and the veins collapse. It can be really, really difficult to get a vessel, an IV in. Same thing if they've bled out or they're in shock. A lot of times they have to put in a main line through their, subclavian artery, or, the jugular, to get an IV in. Um, they have valves. So um, they have valves because blood gets back to the heart by squeezing. Okay. Um, it's unique to veins. They are not in the arteries. There's just valves, and they're in the entire length of the veins. And they prevent backflow. So as the blood gets squeezed up, the valves open, then close. It gets squeezed again, they open, then close. And that prevents blood from going backwards, because if it didn't, we'd be walking around on big balls of feet. Okay. There'd be big balls, and our feet would just be big round balls walking around. So that's how they work. Now, you guys know that all of the veins in the body dump into either the superior vena cava, or the inferior vena cava. So the superior is the head and upper extremities. The inferior is the lower extremities. So as skeletal muscles contract to help push the blood along its path, it just keeps going up, and it's resistant to gravity, because gravity is going to want to pull it down. Now, the pressure changes can occur when a person breathes, and this is also what helps bring blood to the heart for pulmonary circulation. So if you're working out and you need oxygen, your blood pressure is going to go up, right? And that means that the veins are going to return the blood to the heart a lot faster, because it needs more oxygen. Your muscles need more oxygen. If you don't have good circulation, it's going to make you very tired, and you can also get what's called embolus or thrombus. You're going to get clots, and that's because when you're sitting for a long time, your blood is not returning, and it's not, your skeletal muscles aren't working. Your blood just sits there, and it can make you very, very tired. Your abdominal muscles and your thoracic muscles also help return blood to the heart, but it's through the use of skeletal muscle that the blood gets back to the heart. All right, I'm going to stop there and I will come back with venipuncture.